Hi, welcome to Kaweah Delta Medical Center.
We'd like to invite you into the laboratory to view our Beckman-Coulter automation line. I'm here at Command Central of our automation line. Beckman-Coulter has done a wonderful job of designing our footprint so it is very compact. As you can see, the automation line is designed around Command Central. We have the dynamic inlet. We have one centrifuge on the line. The tubes are then routed to one of two AU680 analyzers. They then come around the corner and they are routed to one of two AU680 chemistry analyzers. They go around the corner, they get recapped, and then put into a Stockyard.
I wanted to show you the dynamic inlet. We prioritize the tubes according to whether there's stats and urgents going into our priority rack, which is the red rack. Our blue routine rack, which is for unspun samples. Our pre-spun samples go into the white rack, and these are for our dialysis samples and our samples drawn at our outreach areas. We also put hematology samples in here. Anything that's coming from those areas, they get received on the line and into the LIS so that we don't have to do it in our processing department, saving us time. And then we have our remap rack, which is yellow. All these tubes go down to the Stockyard. Let me start one for you.
This is one of two AU680s that we have connected to the automation line. As you can see, we have tubes coming down the line. They have been spun, they have been decapped, and as they come down the line, they're read on a barcode reader here. Whatever it reads on the barcode will determine which of the AU680 analyzers the sample will go to. We have about 80% of our tests are on both analyzers. The automation line will also balance our workload so it distributes evenly between the two analyzers. And then, of course, if a test is only on one analyzer, it will go to that line. The queue for the AUs will hold about 29 tubes. One feature that we really like about this system is the point-in-space sampling. There's a probe that comes out of the analyzer, samples directly from the tube on the line, and then takes the sample into the analyzer.
Kaweah Delta Medical Center is a 581-bed hospital that includes the main hospital here where the laboratory is housed. We also have a rehab hospital, a mental health hospital, a subacute hospital. We do laboratory testing for 3 rural health clinics.
At the time the hospital was expanding, we were in the process of building a new wing on the hospital which would add an additional 80 beds and also expand our emergency room. So we were looking to have an analyzer that would have an adequate test menu and as well be able to handle the test volume and give us the throughput that we needed.
So we were thinking that with an automated line, it would help us bring consistency to turnaround times and reduce a number of staff we might need for additional testing.
We needed something to be able to handle at least 2 to 3 million chemistry tests a year, to give us the throughput that we needed, and to provide us the turnaround time that we needed in order to meet the needs of our facility. We did the installation in 3 steps. Initially, we brought in the 2 AUs and brought those up. That took place in May of last year.
We brought in 2 DXIs and brought those up in June.
Between then and August, then they installed the automation line.
And we went live with the line August 15th. It was a week's 3 or 4 day process. We went up with the prep link and the 2 DXIs, and they put on one of the AUs on Tuesday. and we were testing that to make sure that it was going to work. We had the other AU offline, and on Thursday afternoon we brought that AU up, and people that were here wanted to bring us down because they were leaving for the weekend and coming back the next week, and I said no. We are up and we're live, it's working. I'm the one working this weekend, we're going for it. So we did, and all worked well. One of the features that we were really looking for when we were looking at new chemistry analyzers was reliability.
We knew that the AUs were workhorses in reference laboratories with very little downtime, and we needed that kind of an analyzer in order to handle our volume and keep us going 24 hours a day, 7 days a week.
We have found that the AUs have lived up to what we were promised.
In fact, our engineer complains that he doesn't get to visit us as much as he would like.
Turnaround times for our lab was a big thing. We have monitored it for many years. We had pretty good means before we went with the line, but the 90% was pretty far out there. We have found with the line we do not have the outliers that we had before. The consistency of keeping the line fed, per se, first in, first out, has reduced our 90% mark greatly. We run about 38 minutes for a basic or complete metabolic panel for our mean, and then 58 minutes is our 90% mark.
So we've reduced our overall average turnaround time, maybe 5 to 10 minutes, but what we're seeing is more consistency, that we're able to have that 90% goal of most of the samples. We like the dynamic inlet a lot. It has streamlined our pre-analytical process considerably.
Because it allows us to prioritize which samples we want to go down the line first. If we have stats, we can put them into the red stat racks. If we have unspun samples, we can put them into the blue racks. If we have spun samples, we put them in the white racks, and if we have samples going to just need to be sent to our stockyard, we put them in the yellow racks. And we try to keep a continuous flow on the line so that we get the best throughput. So we have learned which ones to ask to go next or first so that we don't overload the line with samples. Our stats and our urgents and our time specimens from all departments are labeled with a yellow label so we can see which ones need to be put on the line first or put into the stat rack, and we use those on the power processor in the red rack and process them that way for unspun samples.
The other advantage that we really like is having the online stockyard, being able to retrieve samples, being able to locate samples, being able to repeat critical values, elevated samples.
Command Central was one of the last things we put in place. It has allowed us to be hands-free as far as having to run to instruments to check on when samples may be complete. If the instrument has a problem, we can see it right on the screen without having to see the instrument computer. It's allowed us to, when we receive calls from the emergency room, we can go look at the instruments to see when the completion time will be for testing. We are able to have rules in Remisol that if the sample is critical value or if the sample has a high value, the sample's retrieved from the stockyard and put back on the instruments for a rerun. That has helped a lot.
I would say initially a lot of our staff was very skeptical. But once the whole system has gotten up and running, I think on the whole the staff is very pleased with the automation line and with the way it has made their workday easier. The department is much calmer, much less frantic.
The Beckman staff has been wonderful with the implementation, bringing in whatever we needed whenever we needed it. I have no complaints with the installation and what we went through putting in the automated line, and one of the very first to go with an AU on an automated line. Initially,
I was probably one of those CLSs that was a little skeptical about the whole thing. But now that we're up and running, overall I would say the lab is very pleased with our automation line. Our physicians are very pleased with outcomes, with our improvement in turnaround times. So yes, it's been a very good experience for us.